Yeah, good morning, everybody. You must be all wondering what a cardiac surgeon is doing in this forum. They are one of the most aggressive lots in the surgeons, and he is coming here to talk about preventive cardiology. Sounds funny. But, seeing the dramatic rise of Baba Ramdev and our august crowd, Mickey Mehta, I thought preventive medicine is more lucrative. I think the first lecture did mention, which I missed, than really being a little aggressive in your management. And the thought of getting into this preventive medicine myself was very much ridiculed when I came back to India. And this thought always came from a couple of incidents in my life. I always admired my grandfather. At the age of 87, he was the only person. We used to go to our farm, which was around 5 miles from, at that time it was always miles, so from the main road. So when the bus used to drop us, the bullock cart used to come to pick us up and take us. Everyone, right from my parents, my siblings, my other cousins, everybody used to be crammed into that bullock cart, and he was the only person walking that 5 miles. And he was always 2 steps ahead of us. At the grand old age of 87, he was well on himself, not dependent, and he had a very nice, quick death, I can say, whenever we lost him. So this always was the back of my mind. And, the other thing which, whenever he used to come to our house, we were a very, frustrated lot, the kids. 5 o'clock in the morning, come on, get up. You urban kids, that's what he used to say. You city kids, you just don't know any exercise, you don't know to get up in the morning, you don't want to walk, please get out of this house. So whenever he comes, so I used to ask my parent, when is Dadaji coming now? Because, you have to start preparing to get up in the morning. And the second funniest part, yesterday when I was reading in the paper, in the early morning, we had a ritual in our house of holding our ears and making a murga of ourselves. And you must have read in the paper that now the US have said that this increases your brain capacity and intellectual capacity. So I don't say that my capacity is because of that. But then retrospectively, if you look at, everything is in our culture. And this is what we have, over a period of time, lost it. And that is why we are suffering. And you will be surprised when I go through my slides, what exactly we have been losing and where are we heading to. Now, I happen to be heading the Department of Cardiac Surgery and Transplant in Global Hospital, and it's one of a very, very job where you are always at a stress. So as I said, the doctors are one of the people who are at maximum stress, and they are the one who are the worst patient. I can tell you that. Now, these are the statistics. They are all mind-boggling. Every 1 person dies every 30 seconds, and this is because of an heart attack. And heart attack doesn't spare anybody, whether you are a doctor, whether you are a cardiologist, whether you are a cardiac surgeon, or you're a man on the street. It treats you the same. That is where we just say life and death is not in our hand. It's a very small way of escaping that acute scenario by saying that, well, it was God's wish and he has pulled you out. You have just lost him. We did our best. Did we really do our best? Because the best starts not from the day which I start doing a CPR. It starts from his childhood. And that is what we are not doing. They are thought-provoking, but then that is which we have been ignoring, and this is what is happening. Whether, if you have been very newspaper reader, you will be seeing so many incidents. Recently we lost a doctor who has been running marathon, and then we just lose him one fine morning while walking on the street. And many more. There are no doubt of such examples, I'll tell you. Right in my house, I have lost my cousin who was 5 years younger to me, and he had just moved to United States, Missouri. And in a state of Missouri, in a small town where he had just set up his whole unit, where he had started his business. And I've been talking to him 3 days before. I said, his wife called me and saying, Bhaijan, he's saying, that he's been just smoking left, right and center, and then he's been just with a cup of coffee. He's not eating. He has to complete his project, which is, you just tell him something. So I spoke to him, what are you doing? I said, this is not good. You have gone to stage. So he started giving me example how difficult life is here and all sort of, excuses to avoid my phone call or, get it over. 3 days later, this gentleman completes his project, goes at 7 o'clock in the morning to his client's place to hand over the project. He hands over the project and he drops down there. He just drops down in the United States, in the state of Missouri, where the paramedic came in 10 minutes time and he was flown to the hospital, which was by road 3 hours, they say. That was the closest hospital. What we are talking about healthcare in the United States. Never to be retrieved, having lost him permanently. That's the state, 5 years younger to me. So that's what life we are leading now. Now, in Indians, this is a paper I had submitted when I was in Toronto. I just did a retrospective analysis of patients of Asians against the Caucasians. And when I just took it, when my boss, Dr. David, he said, you're wasting your time. But I said, no, I just want to have a look at it, what we are Indians going through. And we came up with a paper which was published in JTCVS, Journal of Cardiothoracics, one of the premier paper, which said that the Asians are more prone for cardiac events or coronary events than the Caucasians. Now there was a lot of papers because then the healthcare system changes if the paper is accepted. I had sent this paper even to Lancet, which was, of course, for various reasons not accepted. Ultimately, it came to JTCVS. But then it definitely said that we Indians are more prone for coronary and we are exposed to these events much younger than the Caucasians or the whites. So the coronary artery disease, I'm sure half of them now will plan to move to some rural places after these slides. And that was a dream of our father of our nation, that we should strengthen our rural areas. Now the urban people have 65 of the 100 ends up with coronary artery disease, and the females are 45 to 100, and in the rural area is 22, nearly 1/3, and the female is 17. These are all right figures. I mean, there is no fudging of the figures, which we normally do nowadays. Now, if you live in the cities and towns, you have a 3 times higher chances of suffering a heart attack. Okay, and India has the highest rate of heart attack in the world, and it is going up in a phenomenal way. And by 2020, we will be the world's leading, at least we'll be leading in something, I can say. Now, but we need to work hard. Now, current projections suggest that by the year of 2020, India will be the largest cardiovascular disease burden in the world. And 1/5 of death in India are going to be coronary artery disease, surpassing all other things. And still we are ignoring and neglecting this part of it. Now, it will account to 1/3 of death, and many of these will be very young deaths. Very young, talented people will be lost because of their lifestyle. Now, heart disease in Indians, as we say, is because here lifestyle changes. And this lifestyle changes has not gone to only to the elder level or people who are professional, right from our students to our younger kids. Now, very good example I'll give you. Last week, I was hearing some giggling sound coming from my toilet, bathroom, washroom. And I just put because I could come a little early home, and then sometimes it's always better to come home early. So I just heard, and then my son was inside, and he was talking, of course, to somebody with his friends. I said, what are you doing? He's saying, I'm doing potty. I said, potty? And giggling? No, I'm just talking to my friend. I thought I'll finish off this talking business when I'm sitting on the potty. Just imagine, I mean, people just don't want that. What type of lifestyle we are thinking. The same day, in the morning, I see some white flashlight in my bed. And I said, what's happening? So I just wake up my eyes. My wife is checking her Facebook in the early morning hours. So this is what has, and cell phone, I can say, is one of the most important part of our life, which has just been changing to back to worse. I don't know, but I definitely say it back to worse. Because now, as I move in, last night, or rather every night, I get at least 10 to 12 phone calls in the night. And if I count 10 to 12 phone calls, means I can get only uninterrupted sleep of 20 minutes every hour. That means I get a phone call every hour. The 5 hours sleep, 10 phone calls, just imagine. And that is when I'm coming the next morning and operating and again addressing a crowd, august crowd like you. This is what we have ended up ourselves into. We are working round the clock. I think I was the happiest person when during Rajiv Gandhi's time the week was made of 5 days, because now Saturday, Sunday was holiday to school. So I'm sure most of my colleagues at that time, and now also wherever there is a 5 days holiday, we are a happy lot as students. So why not when we are working? Why we are having a 7 days week? We are carrying our laptop home and we are still working. It's all result oriented. We need to grow faster, we need to make maximum money, fast money, and success is the way you are leading your life. Now, when I was coming here, you know how stress level are affecting our life. I'll just put it in the next slide. We are, as Indians, why we are prone for so much of cardiac problems? As in genetic makeup, that is one of the most important factor I found out in my paper when I presented it in JTCVS. It's a genetic makeup which is a problem. We are Dravidians or whatever, half Aryans, half Dravidians, you can call yourself depending. But then our genetic makeup says that we are very prone for this coronary artery disease because there is very high carbohydrate intake. And our physical exertion is not to be said anything. Most of them at 9 o'clock a year, you can imagine. We are always supposed to be sitting in the garden and, you know, doing some yoga and pranayam, but everybody has come here to listen to a lecture. I'm sure there are no CME points for this lecture, I suppose. Because half of them come to earn the CME points, especially doctors. So very little physical exertion due to lack of space and facilities. Mumbai, though, you can see even by the side of a Swachalaya also there is some 2 buildings coming up and people staying on top of it. So there is hardly any facilities and lacks of exercise culture. There is higher incidence of obesity, diabetes, heart disease, and the most important factor is hereditary. Now quickly I'll take you through understand angina, then I can tell you how we can prevent cardiac diseases. Yes, it's a type of a pain in the chest caused by, I don't know if all my august crowds are doctors or there are some non-doctors, but this is how it happens. It's a blood supply to our heart which results into less blood flow, and it's a crying of our muscles, heart muscles, which reflects as a pain. The cry is angina. So that's what we call angina, and this happens just because of plaquing of or obstruction of our coronary arteries. Can I have a glass of water? So what is a heart attack? Don't look at that image. Mickey Mehta will be very happy to see that image. A heart attack is a condition in which damage of an heart muscle takes place because of inadequate oxygen supply to that region, and which happens because of poor blood flow. And this is resulting because of the blockages into our coronary artery. Cardiac arrest is a condition in which the heart stops because of no blood supply and unable to pump enough flow to the body. This is the image that we see. The black part, what you see in your heart, is a part which is the dead muscle because of no blood supply to the heart. Symptoms are very variable. You can just get a gripping sensation, and I'm just putting up the symptoms only because we are people who like to justify our symptoms as nothing. We always ignore, and we give all possible reasons. You have a gastric belching or some sort of discomfort, you will say yesterday uske ghar mein jaake khana khaya na, iske liye takleef ho rahi. You are always ready to blame others for whatever you are going through. Kal ke shaadi ka khana acha nahi tha. And all sort of reason. My boss shouted at me, that's why I'm getting this pain. But it's normally it's a pain in the center of the chest, going to your shoulders, going to your jaws, back pain. So it can come present in any possible ways, and the presentation is becoming more and more variable as you are growing, because there are now off-the-shelf pills available. You get a little bit of gastric, you go to the chemist, Gelusil de. You start hearing the Salman Khan selling revival, you see other doctors selling some or the other, so you also start going and picking up the tablets off the shelf and treating yourself. Now, many times you just get a pain in the jaw, so you blame it on your toothache for it. Now, many times these are all events which ends up, into a heart attack, which should not be ignored. Now, the other important thing what we all should know here is most of the heart attacks takes early morning, 4 to 10 o'clock, that is what is our study. Because we have a circadian rhythm. That's the reason we say that you get up early, you have a early to bed and early to rise. It's all dictums which have been followed by our culture, which we have not been following over years. So this is a time when you start using that adrenaline, which has been secreted in your body for physical exercises. So that balances it out. If it is not used, then it starts working on your coronary arteries and put them into spasm. The most single event in the morning is going and emptying yourself, freshening up yourself. This is one of the most crucial events where maximum cardiac events takes place. So 25% of all heart attacks are silent. Doesn't mean that every heart attack has to come with some symptom. Many of them, earlier we could say that he was asleep and he never woke up. But that's many times it is because of the cardiac event, massive cardiac arrest, and he dies in his bed. No symptoms are there. We are moving on. Is the time off? I'll just quickly finish. So let's move on. I need to tell you what important is to prevent. Where is our role? So when I came back to India, I said, I'm going to start a cardiac rehab center. Whole my family and a couple of my friends were aghast saying, you're a cardiac surgeon, why are you getting into this cardiac rehab and things? I said, yes, because when I was in UK, one of my surgical assistant, she had said, our dogs live better life than what people in India lives. They just don't do exercises, they have something. So I said, no, I just want to go back. I was very offended by this comment when she said that. Of course, being British, they are one step ahead in offending us. But then, that's the first thing I said. Then one of my friends said, it's such a big space you're losing for cardiac rehab. I would say let it out to McDonald's or Pizza Hut, you'll earn more. I said, I don't want to earn more, I want to earn goodwill. And I'll tell you today what I am here is because of the goodwill. Whatever I could, I'm not from Mumbai, I'm from a small town of Solapur, and coming down and settling down is not. I concentrated on the goodwill. Even post-surgery, after bypass surgery, they go through a vigorous cardiac rehab. Pre-surgery, post-infarct, post-heart attack, I all put them into cardiac rehab and start teaching. It's never too late, I say. If I can't do the changes, I start giving lectures into school about how they can support. I go to my kids' school, my children's school, and give them a lecture saying that how important it is for maintaining a good health. So our lifestyle, prevent obesity. The one most important killer is tobacco in our system, which for whatever reason, is we're just not able to get over it. A lot of people in spite, because this industry comes in a different way. Why you try to tackle one thing, you put up a big picture on the cigarette packet with a draconian thing. They come up with some other form of selling their product. Dietary excess, lack of exercise, and alcohol. Alcohol, I'm sure half of will not agree with me, but that's a fact. Too much is not good for us. 74.8% is risk factor increases just by smoking. Hypertension, 18.8%. Hypercholesteremia, obesity, diabetes, and family history. These are all the factors which are the risk factors. And we have started working on this individually. If we can, out of these 6-7 factors, if we can get over even 3 factors, we can increase our lifespan by 50%, which we are supposed to live. So that is how what we see nowadays. Everybody in the evening, their TV is in front. Now we have the recliner sofas, the leg comes up and we are sitting there with a bowl of something by the side. We are just taking away the Western culture. So what's wrong with our lifestyle today? Everything is change. Everything is change. Change is good. But change for worst is bad, and which is causing our increase in our cardiac thing. Time is premium, no doubt about it, but then the way we are leading our life because of because of short of time. My ODA also says that 515 ki local pakadni hai, I have to go. From there I have to catch 613 ki local. That is how Mumbai's lifestyle is. It's all on locals and in the fractionated time, 515, 613, 624, which is leading into it. And money, of course, everybody wants to be, the Bollywood has always spoiled us. We see those lifestyles and we want to imitate and achieve it much faster. So extended working hours, no time for relaxation, no exercise and stress. When I was coming here, I just got a phone call saying your lecture has been preponed by 15 minutes. I am driving. I am on the ceiling. Now I have to reach here. Now 15 minutes, I am just clocking. I said I am coming in 10 minutes. Just see the amount of stress the organizer has put me into. So this is the life what we are leading. Mental stress, doctor has just mentioned. Doctors, mental stress. If you are getting 15 times in the night, what mental stress I am going to go through? You can imagine. And what level I am going to be as when I am telling other people, be calm, be calm. I myself been not sleeping well. This all leads, one factor leads to another. Stress leads to higher blood pressure, uncontrolled diabetes. So positive living, where our Baba Ramdevs and all type of people come here. It's important. It's important part of our life. We are just now getting back to the old system, but only thing the West is telling us that these are good for us. Yoga is a part of our culture. We should be good. So negative reactions is bad for our health. Now, and as I said, it's not necessary that I am absolutely thin and sleek. I am not. But many of them say, I can't be a cardiac patient. No, I've seen a very thin and lean person. He's leading a stressful life. It doesn't mean that his cholesterol is not going to be high. Even very lean patients are going to be high. And every cholesterol is not bad, remember that. There are people, every day I get a query, something goes on the WhatsApp, people start calling me and telling me, is it true? This cholesterol is out of now the danger list. No, it is not. And neither it was always. We have been just tweeting with the numbers, which is, with monetary gains for them. So primary prevention is one of the most important in our treatment. Stress reduction, lifestyle modification, regular checkups. Regular checkups is very important. It can pick up problems much earlier. That's why I said the incidence of cardiac problem is increased by statistic is not only because our lifestyle has increased it, of course it is one of the important things, but our diagnosis has also improved. So every time a chest pain comes, you go to a GP, if the first thing he takes an ECG. It may not be possible in rural areas, but the urban elite are at least, and that may be one of the reasons why you see a higher number of in percentage wise. So yearly exercise ECGs for all about 35 to 40 years, yearly lipid profile testing and screening for diabetes is important, so we can prevent heart attacks much earlier or at least start changing our life. I think we are short of time, but then just a message that I want to give you all. Yes, I am a cardiac surgeon. I would love to have more patients. And without that, I don't think I will be able to survive in this city. But then my heart goes to people. If I can go hungry because of lack of patience, I will be more happy. For that, I want you to lead a very healthy life. Start looking into the various aspects. Don't ignore any sort of symptoms. That will help us to reduce the burden that which our national GDP is going through because of poor health. And even single thing, if we concentrate on good health, I think this country will go far ahead. Thank you very much.